Start your mornings right with the Medicare Morning Show. Join our dynamic trio of hosts, John Davis, William Lacey, and Felicia Evans, as they bring you the latest insights, expert advice, and real-life stories to help you navigate the world of Medicare.
Good Monday morning and welcome back to the Medicare Morning Show. It's Monday, and guess what? We have news and everything that everybody can take along with them and use. So I'm going to bring everybody in. I'm Fee, and we got John in the building. What's going on with you, John?
I'm here. And then, we got William Lacey that was on vacation last week. Lacey, welcome back.
Hey, thank you for that. It is good to be back from out of town, out of country, really. We were in the Dominican Republic. It was beautiful down there. I was able to hit the physical and mental and spiritual reset button. So It's good to be back. And I got to say this, y'all. I caught last week's show with Sherry. Well, that was so good. I mean, really good.
Right?
And informative. Mm-hmm. I'm going to actually review that again on Spotify. I was able to catch it on YouTube. On Spotify, of course, just like a lot of our listeners, I'm a subscriber. So it popped up right away. I was able to listen to it. And yes. And I tell you what, I know I'm jumping the gun here, but I am excited to talk about the most talked about, controversial, misunderstood part of the Medicare system, referred to as Medicare Part C.
Yes, we're going to make it simple today. Real simple.
Yeah. We're going to try.
Well, guys, I'm going to lay low. Y'all know my internet is kind of sketchy today. So, yeah, I know. But, hey, we got a lot to cover, y'all. So, I don't know if I'm in and out, Fee, but can you review what we're going to talk about today, please, for our audience?
Yes, we are going to talk about, like William said, one of the pieces of the puzzle of Medicare that people kind of shy away from, or they hide, or they have different myths about it, which is going to be what we call Medicare Part C. So we'll go ahead and get this started. Okay, we have some notes for you today. Our Medicare Part C.
Nice diagram. Like that.
You know what? I put a lot of effort into this for the people today.
You're good at drawing too. I see that. That's very nice.
Because it talks about all of this and above. So the Medicare Part C is what people hear on the commercials as Medicare Advantage. Okay, yeah. It's Medicare Advantage. And to introduce this, we call it Medicare Part C, right? Private insurance companies is what's approved by Medicare. So Medicare has to approve the private insurance companies that provide, the services and things like that for Medicare Part C. And it most times covers everything in parts A and B. So a lot of people get scared. It's like, am I going to lose Medicare? Am I going to lose everything that I have currently? It's just an addition to. It's an addition to. It's going to give you more in your bucket.
That's probably the most, that's the biggest question I get whenever I've been in the field is, does this take the place of my Medicare? Does it take over, or actually do I lose Medicare? And of course the answer is no, you don't lose Medicare. In fact, you have to have Medicare Parts A and B to get this. So just really quick, the history of this thing. Back in 2003, it was really momentous when Medicare Part D, which you guys covered last week, came in that covered prescriptions. That was huge news. But part of that, it also adopted these Medicare Choice or Medicare Advantage plans that have been out there privately, but now they were able to put the prescriptions, put everything into Part C. They're run by private companies, insurance companies, but they are heavily regulated and they have to follow the protocol of the government to be approved. So you don't lose your Medicare Parts A and B. You get to keep it and you get to have all the benefits that you see on this wonderful chart.
Yes. Like I said, it's an addition to, you just add it onto your bucket, because C has to have the A and B to be one. It's like a puzzle piece. It has to be one.
Exactly.
Oftentimes it includes extra benefits. So, in Part A and B, guys, we didn't speak about the vision, dental, hearing. We didn't speak about that. We kind of like tiptoed around it, but this is where Part C kicks in, right, William?
Yes. And do you need more hearing coverage? Do you need more vision coverage? Do you need more dental coverage when you get older or when you're younger? In most cases,
older.
When you're older. And unfortunately, Medicare Parts A and B do not cover that. And so this is where it's truly an advantage for many people to join Medicare Part C.
Yeah. And that's a good thing too. And a lot of people ask about another question too, William. What is that about prescriptions? You know, oftentimes Medicare Advantage plans include Part B coverage.
Yeah, and they do that many times at no additional cost. So it covers that. You don't get the penalty, and you get some help in covering your medication. And here's another thing about these Medicare Part C. Don't want to sound like we're pushing these, because they are not for everybody.
No.
Everyone has to make their own individual choice based upon their own individual circumstances. However, the advantage of these plans, the way they're designed, is to feel like the plans you've always had when you work for the company, or when your father worked for the government or the electric company, or whatever the case is. You go to the doctor, there's a copay. You go into the hospital, there's a copay, or maybe some co-insurance. They have the similar feel of the insurance that you've always had, and that way it's not really complicated, that if you look at it that way.
Right, or unfamiliar at all. So that's just a breakdown of it too, because it says like, well, you know, what is it about? Like you said, like something you've always had when you worked. Like I said, with the copays. Now, the only thing about it, I know William mentioned that it's not for everybody, and that is so true. Let me tell you why. Because you have to stay in network. You have to stay in network. Now, don't say we're not telling you can go out of town and get sick and go to the emergency room. No. But I'm just saying, just for the full benefit of it, you have to stay in network. So you have a network of doctors and a network of hospitals within the Medicare Advantage plan. So if you have an agent that's actually doing a plan review for you, they must ask you, who are your doctors, to make sure they're covering the plan that you want. You know,
exactly. What
hospitals do you go to? What prescription do you take? Because we want to make sure that you're covered fully within the plan that chooses that's best for you.
Exactly.
Hey, I have a question, guys. So let's just start from the very beginning. So I get my red, white, and blue card.
Yes.
It has my Medicare Part A and my Medicare Part B. Well, what's the additional cost for the Medicare Part C plan?
Good question, John. You want to take that one, William?
Yeah, sure. I actually have some notes. It's funny because Medicare Part C, it is more complicated. We'll just be honest with you. It can get very complicated because there's so much. You're getting all these phone calls. You see all these commercials. You're getting all this stuff in the mail. So let me get back to answering your question. Most of these have a zero cost. So that leads to another question, doesn't it, John? How can it be zero cost, right?
How?
Right.
How?
You want to answer that, or you want me to do it?
Go ahead. You know what? You got the ball. You coming back this week.
Okay.
We're giving you.
I also want to let our listeners know that this material that we get is from Medicare.gov or from humanhealthservices.gov. These are credible sources. And so the reason why, here's what it says. I just want to quote this directly from hss.gov. It says that Medicare pays a fixed amount for your care every month to the companies offering Medicare Advantage plans. Repeat that. The government, Medicare, pays a fixed amount to these private insurance companies to follow your Medicare Parts A and B coverage and to add the additional coverage. So insurance companies do not do this out of the goodness of their hearts. They do this because they're getting paid by the government to do it the way they're supposed to. And that's why many of these plans are at zero cost.
Boom. That was so simplified. So simplified. You feel me? I understood that. You feel me?
I don't understand, and I have more questions.
Okay, well, come on, John.
Okay. Go ahead, John.
So I have my red, white, and blue card, and I get this Medicare. I get all this mail, and I get mailings saying that I now get dental and vision and hearing, or I can get this dental, vision, and hearing. So you're telling me, William, that I don't have to pay any additional other than the Medicare Part B premium, because they're still taking the Medicare Part B premium out of my Social Security check. So how does that work exactly? Do I need to cancel the Part B that I have to pay the money to?
That would be a really big mistake. Good question, though.
Don't do that.
Right now, in 2024, the average cost is $174.70 a month that comes out of your check for Medicare Part B. And that's not uncommon. That is the common thing that people have to do. However, you have to keep that. That is what you call the foundation. Just like a house has to have a foundation to make sure the rest of the house is good to be lived in.
Right.
It's a foundation piece to keep your Medicare Part C. If you don't have Medicare Part B, you cannot get Medicare Part C. Now, I'm sorry, did I lose that question? But also the fact is there's zero cost in that the plans themselves, many of them, not all of them, but many of them are zero cost. A lot of that is marketing. They are competing against other insurance companies, and so to woo or to attract the potential customer or Medicare beneficiary, they offer things and they advertise those things. That's why you get all that mail. That's why you get all those phone calls that you're really not supposed to get. That's why you get all those, you see all those commercials, because they're trying to get you to come to them so that they can get the money from Medicare.
Give me my money.
So the MAPD, when we talk about Medicare Advantage plans, stands for Medicare Advantage and Prescription Drugs. Yes. So with the Medicare Advantage plans, a lot of them automatically include a prescription drug plan that covers your prescriptions. So you're not required to go out and get a standalone prescription drug plan if you have a Medicare Advantage and prescription drug plan. So my question to you guys is, what's the difference in cost for my prescriptions? Am I going to have issues getting medications when I join a MAPD plan compared to just a Part D prescription drug plan?
John's got all the good questions, man.
Questions.
It's almost as if you know what these people are thinking out there, John.
I kind of do. I'm a mind reader in my last life.
Boy. So that, I like how Felicia opened up with the doctors. It is very important that whoever you're getting advice from, that they check the doctors. But John, you brought up another good point, and that's the prescription drugs. Yes, these plans include, many of these plans include the credible prescription drug coverage that you need. However, each company has their own formulary or list of drugs that they cover. So you may have this insurance carrier, this insurance company that you've been using that you love, and they all of a sudden do not cover your drug, or you want to go over to this other insurance company that offers all these wonderful benefits. You got to check to make sure they cover your drugs. Yes. And if they don't, then no, you will not have that coverage on that drug. You may have to switch drugs. You may not want to do that. Your doctor may say you can't do that.
Right.
So it's very important, even though the prescription drug does not cost in many of these plans, to make sure they cover all of your current prescription drugs.
Yeah. And that's just a plan review. That's just a plan review. Like I said, you got an agent that, really knows what they're doing. They will check all of that. They will sit with you and check all of that and be patient and say, okay, let's go about your doctors. Let's go about your hospitals you go to, your specialists. Some people have specialists. Let's see if your specialist is covered under this plan that you want with all these extra bells and whistles. And then prescription drugs. And then we'll, go in there and type in all your prescription drugs and say, okay, yes, that's covered. Yes, that's covered. Yes, that's covered. No, that's not covered, and give you options on that. So yeah, that's what a good plan review goes over, to make sure the plan is for you.
Very good. And if I could just piggyback real quick on what Sherry said last week, costs always go up. That's just life, right? Inflation. Medical costs go up, medical drugs go up. And because of that, even though these insurance companies are getting paid by the government, if they feel they're not getting paid enough for the benefits that they cover, then they will raise the cost of their, what they'll do is, what Sherry said is, they'll put them in a different tier. I'm not going to bog this down with talking about the different tiers, but if it's a lower tier, it costs you less. If they put them in a higher tier, it costs you more. So even your current drug that they currently cover at a lower tier, they could bump it up to a higher tier to try to, I guess, to make sure that it falls under the money that they get from the government.
Yeah.
Okay. So we talk, I know, a lot of people get mailings about the benefits of a Medicare Advantage plan, but let's dig deeper and ask the question, or I want to ask the question, what are the disadvantages? And then we'll talk about the advantages of a Medicare Advantage plan. But for Felicia and William, from you all's experience, what are the disadvantages for people to join a Medicare Advantage plan? William, what do you have on that?
Okay, I'll go first. The disadvantages, Felicia talked about one earlier. I'll let her circle back to that about the networks. I'm going to talk about the copays.
Yes.
And the reason why I'm saying copays, like I said, these types of plans are familiar. If we've had jobs, we've had insurance through those jobs, you have copays, many times higher than what you get with these Medicare Advantage plans. However, I'm talking about these in comparison with the other option, which we may do a future show on the supplements.
Okay.
They don't operate in the way that our traditional insurance that we've known on our lives operate, but they don't do a lot of copays either. In fact, most of them don't have any, very, very few copays. So in comparison to those, some may view the disadvantage with these advantage plans is you may have a $30 or $40 or $50 copay at the doctor. You may have a copay to get an MRI. You have copays throughout the plan that some feel like they don't want to have at that age.
Yeah.
So that could be considered one disadvantage. I'll kick the other disadvantage over to Felicia, what she talked about earlier.
Yeah. So another one I did speak about was network. You retired, you feel me? You like, okay, I'm going to travel the world. Now, my grandkids, I don't have to watch them. I done raised my kids. So now I'm on the road, right? And so, but again, you have to be in network with the Medicare Advantage plan. You have to make sure those doctors are in there. And if you go to another state or to, like it's another country, your doctor not over there. Your doctor's not in that state. Now, like I said, if you get sick, you happen to, come up with something. Hey, go to the emergency room. Yes, go do that. But, as far as those regular checkups and your things you need to do for your specialist, it has to be a network. So a lot of people who travel a lot, they don't see the benefit because they're not home. Yes, my residence here in Tennessee, but I done hit every 50 state already, and I done retired 10 years ago. So I'm always gone. So that's another one too. A lot of people say, well, no, I don't want that because I don't want to be limited to a network. Well, that's just for people who travel.
Yeah, for people for travel, I do find this in my travels is that the rural areas can be tricky, especially when it comes to specialists. And you may have to stay in network travel to a larger urban area where there are more specialists at times if you do have an advantage plan. That's where we run into a lot of, there's a few other tricky spots and I'm sure you guys are aware of them. We can cover them another time, but that's really the trickiest one is in the rural areas, getting good specialists in network. So that again, but it has to, you may have specialists in network. In other words, you shouldn't just cross out the idea of an advantage plan. There is a possibility that everything could line up. And if it does, then you get all these other benefits that we see on this chart.
Okay, so I understand the advantages of a Medicare Advantage, or the disadvantages are having to stick to a network, co-pays for services. Are there any more that could be a downside? I guess finding providers in your current location may be a problem to some people depending on where they live.
Doesn't that seem to be the biggest thing that we find, that if a person has a problem with Medicare Part C, is network and doctors? Some of these insurance companies have done a really good job at trying to establish relationships with hospital systems and doctors, and some they struggle with that, and they may not even be in your area because of that. That is the biggest one. The only other one is the feeling that you're maybe locked in. We can cover that another time, but the fact that if I sign up to this thing and I jump off of my Medicare supplement plan or original Medicare and I sign up to this thing, am I locked in? If I don't like it, what can I do? There are off-ramps. There are built-in off-ramps that the government has put in place. And you know, one of them is the following year, the first 3 months of the year, you can go back to original Medicare. There's another off ramp. I'm actually glad you brought that up, John. This off ramp is on Medicare.gov.
Okay.
And under the guarantee issue rights. And here I'll give you the scenario. Your aunt is she pays $300 a month for this Medicare supplement that she's had for a long time.
Okay.
She knows it, she loves it, but her income is really low. She cannot afford that anymore. And she's in relatively decent health. She's maybe late 70s. She's in pretty good health, but she's scared. She doesn't want to just go back to original Medicare and risk that. So you look into the Medicare Advantage for her, and you find this rule that if she wants to try out a Medicare Part C or a Medicare Advantage plan for 1 year, she can do that. If she likes it, she can stay. If she doesn't like it, she can jump right back on to the same company, to the same plan, and continue on with her Medicare supplement plan the following year. And that's under guaranteed rights situations. So even there's an off ramp.
Yeah.
Go back to the question you asked, John, though. The feeling of being confined or trapped, or I have to wait a year and all those things, sometimes it's not comfortable for people. So that's a disadvantage.
And another thing too, I get a lot of questions. It's like, okay, I got a procedure that's coming up in 2 months. Do I got to have a prior authorization for that?
Yeah. That's another one. You're
right.
right.
Yeah. And that's another one.
The insurance company control, they have to follow the government guidelines, but they do control the situation.
Yeah.
And you have to get a prior authorization.
You have to get something approved.
And we want to, when we think about Medicare Advantage plans, you know, many of those plans are health maintenance organizations, and having a network, it is managed care. So when we talk about prior authorizations, that's not to say that whenever you go, you're going to have problems getting it. It's just the process that managed care uses to approve services and things like that. So, you know, if you're in a situation with the Medicare Advantage plan, it's really encouraged that you work with your provider to submit the necessary documents and paperwork to get services approved, because it is medically necessary services only that's covered by Medicare. So different things like cosmetic surgeries and procedures that's considered not absolutely medically necessary, you're going to have problems getting those services, whether you have original Medicare or whether you have a Medicare Advantage plan.
Right.
So we talked about the kind of the cons of being in a Medicare Advantage plan, but really quickly, William or Fee, can you all discuss the advantages of having a Medicare Advantage plan? It is an advantage, or at least they say so. William, what do you have on that?
Okay, I'll start. We already covered this. Most of them have a $0 cost. Plain and simple. If you're in a financial situation where it is tough, and we do find many of our seasoned listeners in that situation, you come to this part in your life and you thought your Social Security would be a little bit more, or you thought other things would come your way, or you didn't know prices would go up the way they are. Zero cost is very attractive.
Very. I like the extra benefits. I like to go get my vision checked. I like to go every 2 months to get, you know, my cleanings and things like that. So that vision, dental, and hearing piece is a great advantage, because you get that extra, like you used to go when you were working, that extra piece of the puzzle. And on top of additional benefits, gym memberships, right? Yeah. So we still need to move. We need to still be healthy. We still need to, but how do we do that? You know, and there's some gyms that actually go in, like connect with Medicare and then give you gym membership, wellness programs, and things like that.
Yeah,
and we did talk about. Oh, go ahead, John.
I was going to say another benefit that a lot of my clients have had is the personal emergency response system. It's the button. Yeah, Fee, if you fall and you can't get up, you just push the button.
The button.
Yeah, and for a lot of those Medicare Advantage plans, the personal emergency response system comes with the plan for $0 cost. Again, like you were saying, William, as well as transportation benefits, meals provided after a hospital stay. So there are tons of advantages of being with the Medicare Advantage plan. But
Yep.
Fee, like you told everyone, it's important to work with an agent that's going to be thorough and check all the boxes to make sure you're in a good situation. But I think if you're able to get in a strong Medicare Advantage plan and your doctors are in network and the benefits are good, I think it's an absolute
Win-win.
win-win
A win is a
for
win.
everybody. Yeah,
It
for
can be
sure.
a win-win, definitely.
Mhm.
And remember the cap. Remember, John, the cap. It actually caps your medical expenses, which is a big factor against original Medicare, especially, which has no cap.
Right. And when we think about the cap, Medicare considers it your MOOP, which is max out of pocket costs. So
Yes.
with many or all Medicare Advantage plans, it has a MOOP. It has a max out of pocket cost that you are, that if you ever pay over that amount, you pay no more for healthcare services for the rest of the year until it rolls over until the next year. So,
Right. Which is good.
yeah, which is great. So, y'all, we've covered so much about a Medicare Advantage plan. I know our listeners, they're going to have to go back and listen to this multiple times on Spotify or
And take notes.
YouTube,
Like us.
Facebook,
notes.
like us, comment, share, subscribe, all of that good stuff. Because the information that we're giving on a lot of our episodes is extensive information. You always can reach out to us on MedicareMorningShow.com or send us an email or text. We're always live, so you can respond. So any episodes that we talk about, feel free to chime in and ask for additional help. That's why we're here. So
Ask the questions. Ask the
Mhm.
questions. There's no dumb questions, because a lot of times when you have that question, 30 other people have the same question. So you're helping
Exactly.
yourself out and everybody else. And so
Mhm.
by understanding how these plans work, evaluating your options, you can actually make an informed decision. And we're here to help you with that, to help fit your needs. And so, like I said, one
Absolutely.
question could help tons of other people. That
Yeah.
second question. So now we're on a roll on asking all these questions because we can't get everything in 30 minutes. So we need you guys' feedback. We need it. We want it. Give it to us.
Yep, absolutely. So we've covered today, guys, Medicare Advantage plans. Last week we covered Medicare Part D, which is prescription drugs. The week before that, we covered Medicare Part A and B. So go back and look at those episodes. And now you all have a general understanding of the basics of Medicare. A, B, we covered. Then Medicare Part C we covered today, and then Medicare Part D. Fee, I see you moving to D. Medicare Part D we covered with Sherry. Tools that you can use regarding health, community, and Medicare education. We're going to go ahead and finish up today. Thank you all for joining, and we will see you all next Monday at 10 o'clock a.m. Let's
All
take
right,
it out.
guys. Happy Monday.
Bye. Have a good day.